Are there any specific lifestyle changes patients should make before or during treatment?
I would say there's really just one main lifestyle modification that a lot of Americans could benefit from. Uh, I cannot sell this as absolutely necessary for patients to start therapy, but patients, just an overall good physical health, do better with every therapy. And even though these medicines are safe for most patients, every medicine can have side effects. Tylenol, ibuprofen, they can have side effects. And patients who are healthy tolerate side effects much better and have much lower risks of serious problems. So what does that mean? It's just the common sense stuff, reasonable healthy diet, reasonable healthy physical activity. I don't focus too much on the diet side of it because I feel like Oprah Winfrey and 1,000 other people will opine on that on the internet. But this physical activity half, I work in America, and I don't think Americans are doing the best on this, and we all could be doing a bit better. But I say to my patients, if we're going to be doing this for your health, then we should be doing all the basic things. If you go to the car and wear a helmet but not your seatbelt, it's not consistent. So we say to our patients they should be doing physical activity, and I encourage my patients to be doing 30 minutes of some real physical activity at least 4 days a week, preferably 6 days a week. And because the CLL usually does so well with therapy, we have lots of times to encourage that as patients go along. I think that's the main lifestyle modification that would really help patients, and not just because of general health, but really it's been shown in many ways that physical activity actively fights cancer. And patients always say, can I use green tea, blueberries, dark chocolate, ginseng? And yeah, you can use any of those things. But one thing has been actually shown to fight cancer, and that's physical activity. And it doesn't cost a penny, really. So we would like to endorse it wholly.
So fundamental, of course, is a healthy living. Many of the healthy living options for CLL is the ones which for a typical any other healthy person, not to smoke, not to drink heavily, and having a good exercise-filled, well diet thing. These are especially important for CLL patients, though, because the healthier one CLL patient is, the more likely they'll be able to tolerate a more substantial chemotherapy, even if it is a more toxic drug therapy. So a better lung function, for example, renders them more easy to treat a CLL, which might need more toxic drugs. So smoking cessation is helpful from that perspective. They should also make sure that they are being screened regularly for other cancers, because you don't want a second cancer to be an issue. Now, coming specifically to CLL and the drugs, some drugs have actually shown to work better with certain kind of dietary regimens. For example, in breast cancer, for example, we have some evidence that the PIK inhibitors work better with ketogenic diets, keto as we call it. We don't have such evidence in CLL, especially because it's a longer drawn diseases. The patient population is a lot more complex and fewer. We don't have as many CLL patients as breast cancer patients. But we do use some similar kind of small molecular therapies, and one can still look at inspiration from those and think of healthy living and healthy diet being important for CLL. Another thing to remember is that CLL is often treated with steroids in addition, and steroids can lead to rapid glucose intolerance and diabetes, or can lead to weight gains and so on. And so having a moderate diet can also help the patient from those kind of side effects.
How does having CLL change my daily life?
Right, and I think that's a very fundamental question to ask. And I think that is where understanding the type of person they are and the type profiling the disease that is being addressed is fundamental. If a disease is slow growing, not really affecting, causing any toxicities, although the numbers may be very high. The numbers of blood count can be very high, but if it doesn't really affect the other subsets of the blood, or doesn't affect anything else, doesn't cause undue tiredness or loss of appetite or anything else, it's fine to just keep watching it. But that itself can sometimes cause a lot of anxiety to a patient, just thinking that there's a cancer inside growing and we are not doing much about it. So having that conversation is fundamentally important.